In a premium cataract surgery, precision extends beyond simply implanting a multifocal IOL. It begins with accurate alignment to the patient's visual axis. Traditionally, surgeons have relied on pupil centration as a reference. However, the pupil center is dynamic and may not coincide with the visual axis. In this case, the capsulorhexis is intentionally centered on the Purkinje reflex and central triband landmark, a reliable intraoperative landmark that closely represents the visual axis. This strategy allows the IOL optic to align with the patient's true line of sight rather than the geometric center of the pupil. A key advantage of a capsule laser technology is its ability to create a perfectly sized circular and precisely centered capsulorhexis. This level of accuracy enhanced IOL centration promotes uniform capsular overlap and provides a stable platform for premium trifocal optics. As the surgery progresses, notice how the capsulorhexis overlaps the optic symmetrically, creating a stable and reproducible relationship between the capsular bag and the implanted lens. Following implantation, the trifocal IOL demonstrates excellent centration relative to the visual axis despite a slight offset from the pupil center. While this appearance may initially seem unconventional, it represents functional rather than anatomical centration. This ultimate goal is not perfect centration to the pupil, but perfect alignment to the patient's visual pathway. When the visual axis becomes the target, we move beyond cosmetic centration and towards a truly personalized refractive cataract surgery. In this patient, the visual outcome reflected the value of this approach with visual acuity improvement from 20/400 preoperatively to 20/20 postoperatively. In conclusion, aligning the IOL with the visual axis rather than just the pupil ensures the patient's vision is centered where it truly counts. Combined with the precision and reproducibility of the capsule laser technology, this approach translates into better visual outcomes, enhanced optical quality, and ultimately delivers the clarity and quality of vision that modern refractive cataract surgery strives to achieve. Thank you for watching.